There is a growing debate today over for-profit healthcare services in Ontario. CTV's Siobhan Morris joins us now from Toronto with more. And Siobhan, there are some reports out there that Premier Doug Ford's government is set to allow more medical procedures at private facilities. How do doctors feel about this possibility?
We've heard some pushback from doctors. They're concerned for a number of reasons. One, many of them say that they don't believe that this will really solve the problem of clearing the backlog. They think that it'll just create new issues, that it will be a system that's more expensive to run, that will ultimately cost patients extra money, that there will be a lack of regulation, and that will add to the crisis we're seeing in keeping hospitals fully staffed.
Right, and we have heard the Premier say before that Ontarians will not have to pay out of pocket for healthcare services, that they would be able to just use their OHIP cards, their provincial health insurance. So this public versus private debate, it's been going on for quite some time. How does the Premier explain this?
Well, I mean, it is, I think, an issue that dogs maybe all Conservative governments in Ontario to some degree, this belief that there's going to be greater encroachment. But the Premier just explains it, saying that he doesn't think that people really care where they get their care. They just want to have care. And if you're somebody who's in that long surgical backlog, he believes that you just want to get the care. I did talk to a former deputy health minister here in the province of Ontario, an orthopedic surgeon by trade, who says that discussion around Ontarians not paying out of pocket is not entirely true. He says that he's not confident that there would be adequate regulation for the surgeries being done in clinics. He points to cataract surgery, for example, where at a hospital there are regulations around how much doctors can charge you if you want an upgraded lens to give you better eyesight, that there might not be those sort of protections in a private clinic. So he says, you know, that in clinics where profit is maybe a focus, that there's nothing to stop clinics from just driving up the cost and charging patients more.
And so you spoke to that particular doctor. I think we have a clip. Let's listen to it.
The status quo in healthcare is not an option.
Yes.
I've had people from the government or close to the government tell me that they're expecting you to make some moves for greater private sector involvement in the delivery of publicly funded healthcare. What kind of stuff are you looking at doing?
Well, again, I don't even like the word private, because it's really not. You're never, I can assure you, I'm looking into the camera, no Ontario will ever have to pay with a credit card. They will pay with their OHIP card. But if we can take the burden and the backlog off the hospitals and have independent health centers with the same standards, the same actual docs.
So that's the position the government's coming from, that it's really important to clear the surgical backlog to take pressure off hospitals. And that's the reason that we're understanding they're going to announce an expanded role for those clinics as early as next week.
Yeah, and Siobhan, of course, that's not a doctor. That is the Premier, Doug Ford. My mistake there. But definitely a debate that continues. And of course, CTV's Siobhan Morris will be continuing to follow this very closely for us. Thanks.